So I will be talking on the topic beyond corneas, expanding the scope of eye banking. Now, if you look into the evolution of keratoplasty and its milestones, we see that following the first transplant by Edward Zerm in 1905, only a few improvements were made over the next 100 years, which involved mainly the microscope, sutures, antibiotics, and steroids. But there was little change in the surgical technique per se. But the year later on from 1990s has seen a sudden explosion and a rapid explosion in more selective corneal transplantation techniques, especially so in endothelial keratoplasty. So if you look into the trajectory, 1998, Gerrit Mellis first proposed the term posterior lamellar keratoplasty, which was replacing the diseased endothelium with a donor cornea of posterior stroma and endothelium. 2004 to 2006, Mark Terry, Price, and Gorever popularized the same technique in US as DLEC, DSEC, and DSAEK with the automated technique. Mellis introduced in 2006 the DMEC procedure. Simultaneously, endothelial cell injection therapy work started in 2000 onwards from Nancy Joy's work in 2000, where she discovered that the human corneal endothelial cells could proliferate and replicate under special conditions. Year 2018 saw the Kinoshita's landmark benchmark paper, which talked about successful outcomes of endothelial cell injection therapy in pseudophakic corneal edema. And this year we know that there's a commercial availability of injectable endothelial cells, Visnova, where generic name is Neltependocel in Japan. Results of Clara trial, which is on the cell therapy along with rho kinase, is likely to be available this year from the US. Dalk surgery was popularized by Anwar and Teekman in 2002, and this has become standard and reproducible technique in management. So when we look into it, the eye banks, which initially began with the traditional roles of collecting, preserving, and distributing corneas, have gone through a sea change, and eye banks have kept pace with the changing practice patterns and the new techniques of keratoplasty. And the present-day eye banks not just have cornea collection, they have expanded roles and responsibilities to address to the corneal surgeons. Beginning with, in many years earlier, it was the clinicians who used to perform the cornea evaluation. Now it has purely become technician-based donor cornea evaluation in several of the eye banks. Subsequently, the pre-prepared tissue for DSEC was introduced, and this was a natural consequence of increased popularity of endothelial keratoplasty. Now, this was again important because this significantly reduced the surgical times and unwanted delays and cancellations which happen as a result of tissue preparations in the OR. We have also moved on to the pre-prepared tissue for the DMEC surgery, and while DMEC is available, pre-strip roll is available in India, the preloaded DMX scroll is available in US and many parts of Europe as well. Amniotic membrane is another intervention which is done in the eye bank for procuring and preparation for surgical use of various ocular surface surgery. So this is again one area which is very specialized and way of preparing the amniotic membrane, which is utilized for several of the corneal procedures. Scleral tissue, which is procured at the eye banks, is used for glaucoma shunts and patch grafts for corneal immune conditions. If you look into the future of eye banking activities, what is going to probably happen is integration and delivery of translational research technology, which will be adopted in the eye banks, and this will be the need of the hour in the future. Now, to begin with, there's a lot of work which has been already done on corneal equivalence and cellular scaffolds for corneal diseases, and these might probably be, the distribution may happen through the eye banks in future. We also have heard about the growing interest in tissue adhesion surgeries for keratoconus and hyperopia. So component corneal tissues may also become we may also be something which will be taken up by the eye banks, and the preparation of these lenticules and corneal tissue segments, either freshly prepared or irradiated using gamma irradiation, will be taken up in the eye banks. There will be a requirement for long-term preservation, and some of the desolarization processes may be adopted in the eye banks. Corneal lenticle preservation from routine surgeries like SMILE and silk may also be explored as possible source of biological tissues in future. Thereafter, we also have, in the past, cultured epithelial cells were already provided by the eye banks, but it is a possibility that the provision of cultured stromal and mesenchymal stem cells for managing the stromal scars and other disorders may also be, the contact point will be from the eye banks again. Same is for the engineered and cultured endothelial cell therapy for the endothelial diseases. So in future, probably this is just, we don't know when it's going to happen. So this is going to happen. I'm just talking about the global picture. Probably the eye banks, the nomenclature might shift from eye bank to cell and tissue bank in future. Thank you for your listening.
Any comment or question? to Sunita. Anybody in the audience? No question to Sunita?
No question, because she has already explained in the future path. The cell, yes, about
Cell and tissue
the
bank.
lenticule. In fact, the lenticule expansion technique has to develop, because the lenticule, it may be 40 micron or 70 micron, not more than that, and the tensile strength is too less. Then it's a very small button, maybe 5 millimeter, 6 millimeter diameter. But yes, it's a good idea when you think something will come in future. So I feel that this may be a nidus for further expansion of the corneal tissue, the stromal development. So sky is the limit when you think about innovation and research. Whatever looks impossible today to even think will definitely come. Like our generation, whatever now we are doing, myself and any one of us, we had never even dreamed during our residency days 40 years ago. So it's a good presentation and well insight, and I am sure what we have said about the cell and tissue, it will come. And then EBI will also change its name.
Will change to tissue bank, IAN tissue bank.
So
Yeah, many people ask that whether the eye bank will be closed after doing all those bioengineered cornea. I'm think it will not close. What do
it
you
will
think?
not, because these are all expensive procedure though. Do you have any idea what is the cost of this in Japan about the
I
this
think
cell?
Inosita was mentioning in.
So if you look at probably in Indian currency, it comes to almost like 50, 60 lakhs. But I think cost is always subject to availability. When something is
Yeah,
available,
that is
cost will
we
come
know
down.
that.
But at this point in time, the costing is anywhere in Indian currency is like 60
What was the cost he told? I think
I
it is
think them
much more.
6 lakh, but he says 90% is or 90 or 95% is borne by insurance, and rest
That is
5% have
that
to
is
be. Yeah,
there
that is in
there
Japan.
in Japan. But whatever I was told that it is much more, and probably it is in Indian currency. It is close to 1.5 crores. But if you whatever I had discussed maybe a few days back, so that is one aspect of it, and the lab is that lab setup is it has to be given to commercial people. So already America is doing it. So next year American people will come. Probably that time the pricing will be reduced, and how many patients of our could afford those. So that is one side, the research and translational research to give to the patient. Another side, our system of Indian eye banking, whatever I feel that it is much patients friendly. When I talk, you also talk the same. Our total cost come to for DMEC is like $500 to $700. Will people get shocked? How come it could be? So this thing will go parallelly. We know that. So future is always there, and we have to like all this